Hi, my name is Alexis Ryan, and I am going to be giving a presentation on student loan debt in Nebraska. As just mentioned, my name is Alexis Ryan, and I am a senior level nursing student at Nebraska Methodist College. This is important because student loan debt can prevent students from being able to afford things such as housing or even healthcare, which can lead to detrimental health in a lot of people. This is important to me because I have accumulated student loan debt from my first degree and now my almost second degree. And of course, like everyone else, I'm worried about this due to inflation and being able to afford things that matter to me, such as housing, childcare, and healthcare related costs. For my first effective communicator experience, it was during my third year of nursing school, and I experienced a communication barrier during clinical. Um, this patient had had a stroke, and because of this, he was not able to communicate verbally. So we did a lot of closed-ended questions, which he answered with his hand. He'd do an up and down movement for yes, and a left or right movement for no. And although you hear communication and communicating is more than just verbal, you you never really think about it until you see it. And this was a big moment that I realized that. So I learned that not all communication is communicated verbally, and that small body cues are very vital to how a person is feeling. So, flinches and restlessness are just two examples of when a patient is in pain. In relation to student loan debt in Nebraska, many student loan borrowers may not use the same jargon when taking out student loans and not understand like the terms that are being presented. For example, during your entrance counseling, a lot of those words are financial, and if you don't understand what that means, you're kind of just getting into some things that you don't understand. So that presents a communication barrier between the borrower and the loan distributor. So, like medical jargon that the doctor may sometimes unknowingly use to the patient, this is more of financial jargon. For my second effective communicator experience, it was during my fourth year, and this was effective communication that I experienced through interdisciplinary teams that were communicating with the nurse. And because we did this effectively, a life was saved that day. It was during my ICU cardiac rotation, and a gentleman was given a drug called diltiazem. It was a diltiazem drip, and he had a reaction to it that caused his heart rate to drop, him to be diaphoretic, and his blood pressure dropped. I had told the nurse about this, um, and then the teletech had actually called the nurse and told her, so we all ran in there, and she shut the diltiazem drip off, and he was coming out of his state that he was going into. So it actually saved his life that day. I learned that communication is important to healing and promoting health, and that because the teletech had communicated that this was effective, and although it's something so simple, it was something so vital to saving this patient's life. In relation to student loan debt, it is everyone's own responsibility to communicate effectively to give proper care and even save lives, like in this situation. And it's everyone's own responsibility to um, to communicate the amount of student loan debt that they take out and also to paying it back for effective communicating. For my first reflective individual experience, it was during my fourth year, And it was something I had never done before, so it was super new to me. I'd actually helped a patient proceed into death. I had never witnessed a patient die before, and it seemed so sad and so upsetting to me, and I had to reflect on why I chose to become a nurse, which was to help people, to better people's lives. This didn't seem like bettering her life to me at the time, but then after I had reflected on it, we had helped her not be in pain and not suffer and helped her have a dignified, comfortable death with her family surrounding her. I learned that I was put in an uncomfortable situation at times, but all nurses are, and that holism means caring for a patient in all stages of their life, not just the ones where they get to go home and be with their family. In relation to student loan debt in Nebraska, student loan debt can temporarily help a person get through school. However, it can be detrimental to affording other costs in life, like as mentioned earlier. As nurses, we need to be holistic and consider that some people may have other mental, financial factors in their life and may not be able to afford health care due to student loan debt. So we need to be holistic about other people's situations and be compassionate towards them and realize that they may not be able to afford good health care due to the rising costs of school and tuition. For my second reflective individual experience, it was during my second year, and it was becoming competent with G-tube medications. I was on a med-surg floor that day, and I had given medications through a G-tube many times during skills. However, I had only done it maybe once or twice before on a real person, and I was still working on those skills. I had to reflect on what I did well that day and what I could improve on. Of course, we are always hardest on ourselves when it comes to things we need to improve on. And I learned that day that even nurses and everybody in life make mistakes and that we are always learning. We are never too humble or too old to learn something new. Reflecting on the day helps improve our practices for next time and what we actually did well that day and we should continue doing as well. In relation to student loan debt, without reflecting on situations when we have made mistakes, there's no room for improvement. So we can reflect on some student loan debt we have taken out that we maybe didn't need, and we can also attempt to do better by taking advantage of solutions such as paying it off and taking jobs that offer tuition reimbursement and loan forgiveness. We need to reflect on the decisions we've made and take responsibility for that. For my first change agent experience, it was during my first year, and we were practicing our assessment skills at a nursing home. A patient had a sore that had been going unnoticed under one of her breasts, and it seemed to bother her, and she was in pain because of this. Even being so small, it was still an open wound. Although I felt like my opinion maybe didn't matter as much because I was a level 1 nursing student, I had I felt inferior to the nurse and felt like my things that I had to say or tell her didn't matter. However, I sucked it up and I told the nurse about this, and she was very glad I said something because they had gotten some nystatin powder on that and kept monitoring it and made sure the patient was not in pain. I learned that taking a chance on saying something, no matter how small it may seem, is important. I also learned that advocating for the patient, no matter how big or small, is being a change agent. If nobody said anything ever, things wouldn't get resolved. So by saying something, her sore was getting treated and therefore the problem was getting resolved. In relation to student loan debt in Nebraska, educating others, like I'm doing right now, about student loan debt may seem silly and not important, but it's still information that is getting out and probably helping someone or even getting someone thinking about taking out student loan debt or how they can help their situation by getting rid of student loan debt. So all the information, no matter how big or small it may seem, is important. For my second change agent experience, I actually experienced this during my in my place of employment. I had a coworker who I liked as a person very much, but she was violating HIPAA. She always was FaceTiming on her phone and had been confronted about it. And although I don't like confrontation and I didn't want to hurt her feelings, I knew that I was just as guilty by not saying anything to anyone. And she continually would FaceTime while pertinent information about patients was being passed along. So I went to my supervisor, and the proper repercussions were given to that employee, and no hard feelings were felt. I learned that this is being a change agent, and sometimes making a change, you're not going to make everybody happy, and it can be uncomfortable, but it's necessary to abide by the policies and procedures of the healthcare system and to protect patient information. In relation to student loan debt in Nebraska, working to save up for school or taking a job may help you pay off school, and it may not be comfortable for you, but you're changing your life to pay off your student loans. So the situation you want may not always be the one that's ideal or that you want right away, but hard work pays off and doing the right thing pays off as well. So, yeah. In conclusion, I have had many chances throughout my nursing school career to be an educated citizen, and I've taken advantage of those by being a reflective individual, change agent, and effective communicator. I am fortunate enough to build upon my skills as an educated citizen for the future, both in my workplace and as well in everyday life. I am very grateful for the opportunities that I have been presented with in nursing school and will continue to build upon them. Thank you.